Welcome to this week's show, When Your Health Matters, the show designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center, located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. And that's again in Pooler, Georgia. If you want to stop in, that would be wonderful. I'd be happy to meet you. Due to COVID-19 and people's fears of coming in contact with strangers, etc. Don't want to be a stranger in your life. I actually want to help you in your life, get more out of your life by improving your health. But if you're a little bit reticent right now to stop in to see me, you can always call me directly at area code 845-561-2225. Again, 845-561-2225. That is my cell phone. I will be the one answering the phone. Please do not text that phone, as that phone does not receive text messaging. You'll send me a text, I won't get it, I won't respond to you, and that defeats the purpose of me giving you the phone number. You can also email me at docrick@spineboy.com. That's a better way than texting. You can do the same thing as texting, but actually send me an email at docrick, DOCRICK, @spineboy.com. And whether you stop in, call me, or email me, it's my pleasure to help you to better understanding what the concerns you have regarding your health. This show is called When Your Health Matters. This newsletter is called When Your Health Matters. I'm doing these weekly. If you've had the opportunity to go back to the month of January, there's 5 different videos that are available during the month of January. We will have at least 4 this month, possibly 5 this month, being the month of February. Welcome to February. What do we talk about in the month of February? Well, we're going to talk about bladder health, but today we want to talk about something that impacts bladder health, which is vitamin A. And vitamin A is the first vitamin ever discovered, and it's a very, very important vitamin for a number of reasons, which I'm going to get to. But I would love for you to watch through this video and learn about possibly your vitamin A deficiency, or loved ones or friends or colleagues or other people that may have vitamin A deficiency based upon the conditions or the health challenges that they have in the various areas that vitamin A influences. So, jumping right into it, vitamin A functions to help promote normal tissue formation. It increases blood platelets, so if you have any issues with your blood, vitamin A is very, very important for that. It promotes a feeling of growth and of overall well-being. We could all use more of that nowadays, especially with quarantining and COVID-19. Promotes appetite and digestion. So if you have a digestive system that isn't working very well, or your appetite isn't as vibrant as you would like it to be, chances are you could have a vitamin A deficiency component, and we will want to check that out. Vitamin A helps prevent infections, specifically in the eyes, in the tonsils, the sinuses, the air passages, the lungs, the GI tract. So again, with COVID-19 and people potentially developing respiratory infections, vitamin A is a very, very important component with helping the lungs to heal and make sure that their immune system is very, very strong. Again, that's good for COVID worries. Now, what are the results of a vitamin A deficiency? If you don't have enough vitamin A in your diet and you're not absorbing enough vitamin A, you would have a loss of appetite. That would be the first thing that you would probably notice. Retardation or development growth problems, meaning that you're not growing the way that you should be growing. Don't mean to offend anybody with the term retardation. Physical weakness. People who suffer from physical weakness potentially have a vitamin A deficiency. Susceptibility to weaknesses of the eyes. Are your prescription lenses getting stronger as you continue to age? You may want to look into vitamin A's component to eye strength. We're talking night blindness, corneal ulcerations, etc. You could have ear issues like otitis media, which is an infection in the middle part of your ear. So people who get those potentially have a vitamin A deficiency. What else are we looking at here? Oh, we're also looking at your kidneys. Your kidneys, anybody that has kidney stones, not a pleasant situation to have. I'm told it's more painful than childbirth. So ladies out there that have given birth to a child, if it was very discomforting for you, just imagine that on steroids, and that's what my understanding of passing a kidney stone is. So we don't ever want anybody to have that issue. But if you've had kidney stones in the past, there's a high degree of likelihood that you have a vitamin A deficiency, and you'd want to get on to some vitamin A supplements. Any diseases involving the air passages, okay? We're talking your sinuses, your lungs, your respiratory passages, meaning your bronchioles and your bronchi, and as the air comes into the body, all the different passages associated with that. So you want to think COVID. Skin infections, typically a vitamin A deficiency. Bladder issues. Like I said, we're going to get talking about bladder this month, the month of February. So we'll be talking about bladder health and vitamin A and how it impacts that. And also issues related to your stomach and potentially your colon. These are all areas that vitamin A influences. Women who have difficulty, should I say couples who have difficulty conceiving, getting pregnant, wanting to have children. If women have difficulty with their ovulatory cycle, there's a high degree of likelihood that there's a vitamin A component associated with that. Secondary anemia, okay, not iron deficiency, but other types of anemia associated with not having enough of the proper blood cells or formation of blood cells or the blood's ability to do its job. That is typically associated with a vitamin A deficiency. Excessive growth within the lymphatic tissue, so lymphadenopathy, any diseases associated with your lymphatics, potentially cancer of your lymphatics. And then last but not least, this happens in a lot of seniors, dullness or perversion of your special senses, where you're having difficulty hearing, difficulty seeing, smelling, tasting. Tasting is associated with COVID-19, or just your general sense of touch and numbness and things associated secondarily to chronic diabetes. So those are all the reasons or the results of deficiencies associated with having a vitamin A deficiency. So in the absence of vitamin A, okay, people may develop eye inflammation or ulcers in the eyes. I had those growing up as a kid. Actually, through my 20s, I had that. That was for other reasons, but vitamin A certainly could have been involved in that. People who stop growing early, you know, their family members are all taller than they are. There could be a vitamin A component associated with that. Poor appetite and digestion. Getting back to your sensory organs, if you have excess amounts of cerumen in your ears, so your body produces too much earwax, that could be a vitamin A deficiency. Whether you have infection in your ears, that's a vitamin A deficiency. And again, deficiencies in your sinuses, if you get sinus infections, any glands in your throat or the base of your tongue, and if you get basically infection in your mouth, those are typically reasons for as a result of vitamin A deficiency. People who have difficulty conceiving, if you have trouble getting pregnant, you'd want to check into the fact that you could possibly have a vitamin A deficiency. And again, we mentioned earlier, if you have kidney stones. Kidney stones is usually a byproduct of not having enough vitamin A, so you definitely want to get in front of that. So what are the most reliable sources of vitamin A in our diet, and where can we get more vitamin A? Well, you can get vitamin A from any dairy product, okay? So we're talking dairy, whole milk, we're talking cheeses, we're talking butter, we're talking egg yolks. These are all high sources of vitamin A. I pretty much take all of those except for whole milk. I don't drink milk. My personal feeling is that milk is meant for cows. Goat's milk is meant for goats, and mother's milk is meant for children, infants. I don't feel that we need milk as adults, but the Dairy Association may argue with me about that. We should get calcium from other sources. Leafy green vegetables, that's a source of vitamin A. Yellow corn, yellow sweet potatoes. What else do we have? Carrots and other yellow and green vegetables. Those are all high sources of vitamin A. Vitamin A shouldn't be a deficiency, but you may have an issue with assimilating your vitamin A, and that's a deficiency reason. And so we can check to see if you have maybe a sensitivity or an allergy to vitamin A. If you don't, then perhaps you're just not absorbing the vitamin A the way that you're supposed to because the body has some level of resistance. We can check and fix and correct all of those things. So it's most important to ask yourself, am I assimilating my vitamin A? Do I have enough vitamin A, or do I have a deficiency? So that's my offer for this particular month. I'd love for you to come in and ask me to check your vitamin A levels so that we can do an evaluation. The evaluation is free. I just need you to call the office so that we can schedule that, so that when you come in, we can get right to that and make sure that your vitamin A levels are what they're supposed to be. And if they're not, we will help you supplement your vitamin A, either with Cataplex A or Cataplex ACP. There's a lot of different supplements that I have that has vitamin A in it because it's very important. So in order to set yourself up for success, I would ask for you to call me at area code 845-561-2225, or you can email me directly at docrick@spineboy.com, or you can stop into the office and we can do a vitamin A check. And that's the special that we're running for the month of February. So please take advantage of it. I appreciate you tuning in. I'm going to ask you to tune back in next week, same health time, same health station. This is Dr. Richard Huntoon from Advanced Alternative Medicine Center saying, I appreciate you being here. Thank you for the comments. Please leave any comments on this that's beneficial, or if you have any other questions, leave a comment regarding that. And I'll be with you again next week. Thank you so much. Have a great day.